This program was made possible by grants from the John and Diane Laxmi Family Charitable Fund, the Asfar and Maheen Malik Family Foundation, and the Missouri Asian American Youth Foundation.
People will still develop a depression even in spite of having what they perceive to be a good life.
Hi, I'm Aisha Sultan, and these are things we don't talk about. Sean is a 45-year-old lawyer. He's been feeling persistently sad and tired. He's lost interest in activities he used to enjoy, like meeting up with his friends. He's felt this way for a few months. It's also harder for him to concentrate at work. He and his wife have felt disconnected lately. They argue over little things. His work situation is stressful, and last year he lost a close friend to a sudden heart attack. He has a supportive family, but it's hard for him to talk about what he's been feeling. He doesn't have any history of mental illness. His mom often seemed depressed or anxious when he was growing up. His doctor did a physical exam, and the lab results ruled out any medical causes for his symptoms. I'm joined by my guest, Dr. Jordan Fields, and Dr. Eric Lenze, head of psychiatry at Washington University, and you are a clinical psychologist. So help us understand in this hypothetical case study what might be going on. Dr. Fields, is it normal for depression to just show up out of the blue when you're this age?
Well, depression can show up at any point of the time in a person's lifespan. So we typically see it showing up early on in the teens or in the early 20s, but it can go across the lifespan. We actually see people who are elderly experiencing a lot of depressive symptoms.
Interesting. Dr. Lenze, why might that be?
Well, we don't know entirely why one person might develop depression and another would not, but we know it's rooted in biology, including genetics, as well as life experiences like traumas that happen to us at a younger or even an older age.
So how would you know as a doctor whether someone is just going through a rough time, feeling blue, or whether they're actually have a diagnosis of depression?
I think you look at both how long or the duration of the problems and the severity of the problems. Is this something that comes on once in a while and then goes away, or is this persistent and pervasive throughout your daily life?
Like if it goes on for months or weeks, or what would you say?
Well, the cutoff we use is 2 weeks, but most people who are suffering from a clinical depression have been dealing with it for months or years.
Dr. Field, in your practice, how long does it take before someone comes to you? And what do they say when you can kind of figure out, well, maybe this person is depressed?
You know, that varies from person to person. Some people are much more in tune with themselves and aware of the experience of struggling and being down or depressed. But other people take a little bit longer to become aware and understand that they're struggling and there's this emotional pain that they're experiencing.
So if somebody like Sean came to you, what would that look like? What would he even say if someone's never been in therapy before? It can be a little intimidating.
Happens all the time. Typically when somebody's coming to me the first time, they're really not sure what to talk about. They're not sure, what's going on with them. They just know that things are not where they want to be in life and their symptoms are impacting their life significantly, and they want that to change.
Do people come in and say, I don't even know where to start, or I don't know what to tell you, or what do you want to know?
Absolutely.
And then what do you tell them?
So I tell them that I'm here to help them to understand their experience. And to me as a therapist and as a psychologist, I think my role is help people to understand themselves so they can act differently and in a way that's going to shape and change their life for the better.
And how do you know whether to refer them to a psychiatrist?
So that's difficult. So, the best research shows that typically a combination of therapy and meds tends to be best, particularly for those with moderate to severe depressive symptoms.
Dr. Lenze, how can you tell if someone needs to be on a medicine when they do come to you, whether it's a referral from a doctor or however they find you?
Well, I agree. It tends to be people with a more moderate or severe symptoms of depression that often do best with medications, often in combination with therapy. Other things are people who in the past have benefited from medications, or people in their family have benefited from medications.
And how common is depression in our society?
It's a very common problem. Some people have pegged it as up to about 25% lifetime, maybe about 10 to 15% at any time.
Now, that doesn't mean 25% of us need to be on medicine, does it?
Well, no, I don't think 25% of us need to be on medication, but I think there are a lot of people out there who would benefit from medicine who are not on medication.
What are the fears that you hear, especially from people like Sean, a middle-aged man who does not have any previous experience with psychiatry? And what are your fears of what might happen if Sean doesn't seek somebody either for therapy or, medical treatment?
Well, I think people have a lot of fears about seeing a therapist or a psychiatrist because there are, a lot of myths about it. But there is, in fact, danger of not getting help.
What are those dangers? Can you tell me a little bit about those dangers?
I think the biggest danger, well, let's put it out there, is suicide. And that's a very common problem in the U.S., more than 50,000 people a year. But for particularly, we're talking about a middle-aged male here, there's a big concern that they might, instead of getting professional help, might try to take it on themselves and even self-medicate with something like alcohol or drugs.
Do you find that there are people who are using other symptoms or other ways of trying to cope with feeling bad?
Absolutely. So when we think about depressive disorders, we're thinking about an emotional condition where people are kind of decreasing their engagement in their lives. And oftentimes they try to find ways to ameliorate or to decrease the amount of distress that they're experiencing. And that often comes in the form of something like a self-medication of like alcohol or other drugs.
And why can't just, there are sometimes people feel like, I'm having my needs met, I have a job, I have a good family, why am I feeling this way? Do you find that people kind of blame themselves and think, what do I have to be depressed about? Dr. Fields, if you could address that, and then Dr.
That's a very common thing. So sometimes we have things going really well in life. And oftentimes, because of some of the vulnerabilities that Dr. Lenze talked about, people will still develop a depression, even in spite of having what they perceive to be a good life. There are a lot of factors, like the way that we think, that can go into and influence the development of a depressive episode.
Yeah, I think as a society, we've been conditioned to think of problems like depression as like a moral failing.
Right.
Or
like, why can't I just pull myself out of this? Why can't you snap out of it?
Yeah, I should be able to pull myself up by my bootstraps, as it were. You'd never think about that about diabetes or high blood pressure or a heart attack, that you could just snap yourself out.
Pull yourself, I'm going to will my way out of this heart attack. We wouldn't think that. Why do you think we feel that way about depression? Dr. Lenze?
Well, I think depression is mysterious, like other mental illnesses for us, because it's rooted in the brain and the mind. So it's just not as easy to understand for someone as something that's sort of flesh and blood out there.
That's great. And Dr. Fields, how long would it take someone, if they come to, and someone like Sean in this exact situation, how long is it going to take before they start to feel better?
That's the thing that's really difficult to say, because sometimes people have a belief that I have a lot of things that have happened to me in my life, so it's going to take a long time to work through all of these things. But really what I see is there's kind of a dose-dependent response. So
what does that mean? I don't know what that means.
To me, what that means is the consistency and the effort that we put into the therapy that we're working on, we get the benefits that are consistent with that amount of effort that we're putting in.
So like if someone comes regularly, shows up, and is honest in therapy, then they're going to get better faster.
Typically, yes. Typically, that's what I see, is that engagement and that willingness to look at things differently, develop perspectives and new ways of approaching the world and ourselves.
Okay, so when somebody talks to you about, okay, this is how I'm feeling, then where do you go with that conversation? Like, Sean comes in, I'm having trouble at work, I'm fighting with my wife, I don't feel like seeing my friends, I know I don't feel right. And then where does that conversation start with him then?
So for me, I take kind of a biopsychosocial perspective, which means that I'm looking at everything. I'm looking at biologically, what are the vulnerabilities? Psychologically, what are the things or the ways that you think that kind of feed into this type of depressive type of disorder or episode? I'm thinking socially, what is social learning? So what are things you saw in your mother when she was dealing with depression and anxiety that taught you that this is how you cope when you're struggling with emotions? So that's kind of where we start.
So are you asking questions? Because a lot of people have never been there. They don't know if they're just supposed to show up and start talking about themselves. That feels really weird.
It can feel weird. A lot of us aren't comfortable or don't like talking about ourselves. We're not socialized that that's okay to do so.
Right.
And people feel uncomfortable with that. But my job is in part to help you feel comfortable and to get into that information that's going to help us to have the best course of treatment.
Now, Dr. Lenze, are there people who come to you, and by this point, I imagine they know that there's a problem because they're in a doctor's office, but they still don't want to take medicine? Have you ever had that experience? And how do you convince them that it might be the best thing for them?
Oh, very much so. I think often it's just answering concerns people have about medications. They might think that they're addictive or that they're going to produce some sort of a change in their personality or who they are. And these medications don't do that. What they do is relieve symptoms.
And how long does it take? Like, how many tries might it take with medicines? How much you need? Because like you said, you can't just order a lab and see, I'm happier now.
That's a really good point, Aisha. I do want to say that people often feel a little bit better, sometimes even a lot better, just from the experience of going to a therapist or a psychiatrist and getting an answer for their problems.
Right.
I've had many people walk out of the first session saying, God, I feel a lot better now that we just have a treatment plan. But there's also a downside here, which is we usually don't know from the get-go what's exactly the right treatment, whether it be the right medication, right dose, or the right therapy for someone.
So how do you figure that out?
Well, it can be a trial and error process. So when we work with patients, we try to engage them for the long haul. Say, this might take a number of weeks or months till we find the right approach for you.
And I want to be totally upfront with people. Like, there are some side effects that people can experience from different medications. Can you tell us about what those side effects could look like for somebody?
That's right. No medication is without side effects. I think the good news here is we now have a lot of different medications. So if you have side effects to one medication, we can try a different medication. And of course, if you find you don't tolerate any medications, psychotherapy is a really good approach as well. And we have non-medication approaches like transcranial magnetic stimulation, which uses magnets to stimulate the brain, and other newer treatments like that.
Oh, wonderful. Now, Dr. Fields, are there certain barriers in different communities? Let's talk about the African-American community, in which it's harder to talk about these things or to admit these things. Can you speak to that experience?
Absolutely. There are many communities where it's difficult to talk about and engage in this idea of mental health in general.
Okay.
I think it's particularly difficult because culturally, I think there are expectations about things like strength and...
Especially with men. Like, I'm strong and masculinity is tied up in being strong,
and
right?
we perceive having some of these struggles emotionally as not strength and maybe even a weakness. And I think that, we're still working to improve that in different communities, but it's very real and it's something that a lot of people have to contend with.
And what's the ramification, what effect do you see for like the African-American community where this hasn't been as normalized or as talked about?
Well, oftentimes people don't seek care, and these conditions go untreated for extended periods of time, and people tend to have worsening symptoms over time because of the lack of support that they get.
Dr. Lenze, do you see disparities in health outcomes because of the lack of access to even psychiatric care? I mean, we hear about, different health outcomes based on whether you get treatment for diabetes or during your pregnancy, but is that also true with psychiatric illnesses?
Oh, most definitely. And unfortunately, this disparity is an access issue with certain racial or ethnic groups or people with people who are dealing with poverty or have a lack of insurance, finding it less possible to get access to high-quality mental health care.
So how do you start? Like, let's say you think, okay, maybe I should do something about this. Do you just start Googling therapist in my area? I mean, it sounds basic, but I really don't know.
I think that's a really good place to start. So the internet's a great resource, and something like Psychology Today is a great resource to find a therapist. So you can go in and put in your area, and you can get a number of therapists who pop up, and they have different specialties that are laid out for you, and you can reach out to those individuals and see if they might be a good fit for you.
Like, do you just leave a message? I mean, what does that process look like trying to find a therapist?
I think the thing that I think is important for people to understand is that during the day, the therapists are actually seeing clients. So you may not receive a call back right away, or they may not even answer the phone. But you wouldn't want somebody who's working with you to answer the phone while you're in session with them. So understand that there may be time that it takes for them to get back to you, but typically they'll reach back to you in a timely manner and then talk about how they approach therapy and if that might be a good fit for you.
So that conversation is free. Like, you don't have to give them their insurance information right away or pay for it.
Yes, most therapists are completely okay with and happy to give you information to make sure you might be a good fit with them.
Okay, great. And Dr. Lenze, how does it work if you need to actually find a psychiatrist? Do you get referred from your primary care? What's that process like?
Well, I think a lot of referrals do come to therapists. Another very common route is from a primary care doctor. And for most people who are started on antidepressant medication for the first time, it is from their primary care doctor.
Oh.
Most primary care doctors are skilled and comfortable with prescribing frontline antidepressants. And then a psychiatrist will usually see a patient if that medication is not working and something more is needed.
And then how long does each appointment with you take?
Well, an initial appointment with a psychiatrist is usually an hour. So I guess one way to think of it is just an hour of your time to figure out how to deal with and treat a really complex, but again, very treatable problem.
And then after that, how long does it take? Like, how often do you have to see someone after that?
It really varies. Some people respond beautifully in a few weeks to the first medication that we try. For other people, it's, as I said, a bit of a trial and error. We have to try multiple different treatments. And I have to say, for some people, the severity of their depression is such that we really need to see them frequently just to keep an eye on them, make sure that they're safe, and know that they're supported.
Interesting. And I know that there's been rising rates of suicide in different ethnic groups, in different ages and demographics. And we hear a lot of talk around this mental health crisis in this country. Is this really a new thing, or are we just talking about it more? Dr. Fields?
I think that both the internet and social media has made it more accessible to people to talk about these things. So it's great in that people have more access to information and people can communicate about what they're experiencing. But I think that a lot of these things have been around for some time, but we're just becoming more open to talking about them. With stigma decreasing, people feel more comfortable with talking about their experiences and their struggles.
Right. I see people on Instagram talking about their diagnosis, talking about their medication, and sharing that. I don't know if people from our generation would be as comfortable doing that, but definitely people in younger generations, I feel like, talk about it a lot more openly. Dr. Lenze, what would you say you've seen as the groups that are most reluctant, or that you would say need really to think about being more open to these conversations?
Well, I think this is a great case. Here you have a middle-aged man, someone who is in a profession that has a lot of prestige to it, and also probably has a lot of demands on their time. So I think, as Dr. Fields said, men are more reluctant to or less likely to seek out mental health care. And people often may feel like they just don't have the time to seek it out.
Right. Like you said, people might feel like they don't have insurance, they don't have the money, and sometimes the wait for a therapist is really long, or the wait to get in with a psychiatrist can be really long, and you might just give up. Are there any myths around depression that you want to clear up that you feel like we don't talk about enough?
So I think a myth that comes up, and I think we've talked about this a little bit, is this idea of kind of bootstrapping and pulling yourself up by your bootstraps and just working through it. And the way that I conceptualize and I think about that is the idea that I can just persist in my life the same way that I always have and expect the outcome to be different emotionally for me. And I think it intuitively doesn't make sense, but yet we still believe that that's possible.
Like, if I just keep pushing, if I just keep trying harder, I'm just going to get better.
Yes, trying harder to be happy, and I will be there.
Right, interesting. And do you feel like people come to you because they feel like it's hurting my relationships or it's hurting my work? Like, what do you feel like is the tipping point?
Relationships tend to be one of the biggest places, right? So relationships are incredibly important to us. Humans are social creatures.
Right.
And so when we start having things that are impacting our relationships, then we tend to start seeing like an alarm and having this draw to really seek out something that's going to fix that problem in the relationship.
Dr. Lenze, do you feel like families are generally supportive of people that you see, or do you feel like sometimes people have to come in against the wishes of their family members, or maybe their family members don't want them on medicine? Have you ever encountered that?
I've seen all of those scenarios, but I would say that most of the people I've seen, it's often at the support of their family that they come in. One of the tragedies of depression is that it saps you of the will and motivation and even the ability to think through how to get out of depression, which means the illness itself prevents you from going to get treatment for the illness.
So what do you do if someone like you care about, that you can see, like isn't getting out of bed, or they're always irritable, or they're not interested in, eating or they're eating all the time? It's like a big change. And then you say, like, maybe you should talk to someone, and they're like, no. Okay, so what does a family member or a friend do in a situation like that, Dr. Lenze?
What I've seen has often worked is family members being persistent and a little bit assertive here, saying not just I think you should get help, but hey, let's make this appointment on this day. I'll take off work and we'll go together.
Oh, wow. Yeah, that's totally different than just saying, you need to talk to someone, you need to get help, but rather saying, here, let me help find someone that's in our insurance network, let me make an appointment, and I'll go with you. What about you, Dr. Fields?
Absolutely. I think being supportive and being patient and caring, those sorts of things, that trinity of relationships can be really helpful to get somebody to the point where they're starting to open themselves up to the idea of pursuing help.
Well, I think one of the biggest myths is something that we've been conditioned by society really throughout history for mental illnesses, is to view them as a moral failing, like it's my fault or my parents' fault that I got depressed.
Is that the case?
No, manifestly not. We think now of depression as caused by biological issues like your genetics, psychological issues like early life experiences like traumas, and social issues like just your circumstances like poverty or life stresses.
Can we talk a little bit about how difficult it can be for someone who's living with someone who's depressed? Mm-hmm. Because that's also, even you might not have depression, but if your parent or child or spouse does, what is that experience like?
It's not fun. I think that it's important to know that you have to support yourself and take care of yourself well when you're dealing with somebody who may be struggling with some type of emotional condition, regardless of what it is. So make sure that we're engaging in our own self-care, trying to make time to take care of those things that maybe the other person's not able to support us in the house, So those are things that oftentimes come up.
Okay. What about you, Dr. Lenze?
Aisha, I think you nailed something really important, which is just how the experience of one person in a family with depression can be so frustrating and difficult for other people.
Especially if they don't want to get help. And you're like, something's clearly not right, but you're denying it, you don't want to get help, or you can't force yourself to get help. It's difficult for everyone, not just the person who feels bad. Mm-hmm. It's hard for everybody in that family.
And think about how the illness presents, irritability, withdrawal. These things often feel to family members like maybe someone's doing it on purpose.
Mm. It can become almost like a vulnerability for the family member to develop another, condition, like another depressive disorder, because of the stress of having a family member who's struggling so much, and you care so much, and you empathize with them. That can be a vulnerability for developing something like a depression yourself.
Oh, that's so interesting. So it can be useful for the person, a family member, to actually talk to a therapist or get care if they're living with someone who's depressed.
Absolutely.
Wonderful.
Yeah.
Well, thank you guys both for coming on and telling us more about this. And I hope that this was really helpful.
Relationships are incredibly important to us. Humans are social creatures.
Right.
And so when we start having things that are impacting our relationships, then we tend to start seeing like an alarm and having this draw to really seek out something that's going to fix that problem in the relationship.